So hi everyone, thanks for joining us tonight. We're just going to give it a couple of minutes and just let everyone join. Okay, I can see we've a good few people in now, so I might just kick us off then. Just before I hand over to Olympia, I'll just do a few minutes of an introduction just into SIMS. So thank you everyone for joining the webinar. So tonight we're going to cover the Access Fertility Programme. So my name is Katie and I'm on the marketing team here at SIMS. So just a quick introduction to SIMS. We have 6 clinics around Ireland. So we have 3 main clinics and 3 satellite clinics. Our main clinics are based in Clonskea in South Dublin, Cork and Swords in North Dublin, and our satellite clinics are in Carlow, Limerick and Dundalk. We're also part of the Versus Health family, which is one of the world's leading fertility groups, and this allows us to share our experiences and knowledge from all around the world, ensuring that our patients get access to the very best reproductive medical care. At SIMS, we offer a range of services such as fertility treatments, testing and investigations, fertility preservation, options for single women and options for same-sex female couples. So with that, I'll hand you over to Olympia from Access Fertility, and she will talk you through the Access Fertility Programme and answer any questions that you might have around it. So if you do have any questions throughout the evening, just pop them into the Q&A box and Olympia will answer your questions at the end of her presentation. So thanks, Olympia. If you want to take it from there.
Great, thanks for the introduction, Katie. Well, I hope everyone can see the screen and everyone can hear us as well. So my name is Olympia and I'm here today on behalf of Access Fertility. And today we'll have an overview into the programs that we offer with SIMS IVF, and we'll have a look at how they work, how you can register with us, how payment is made, and we'll talk a little bit in general about the ins and outs of Access Fertility and what we can offer for you. A little bit of an introduction onto our company. So we were established in 2015, and in our first year, we were only operating in the UK and we were partnering with about 5 clinics. Fast forward that to 2023, we're now one of the biggest IVF refund providers in the industry, and we work with over 70 clinics in the UK, in Ireland, and in Europe. And here we've got the program overview. I'll just quickly skip through these and explain them for you as we go. So we offer 3 types of programs. We've got the refund program, the unlimited program, and the multi-cycle program. We'll have a look at the refund program first. So a refund program can offer you up to 100% refund if you don't have a live birth. And I say up to 100 because even though the refund program split into 3 categories, it is exactly the same. The ins and outs of it are exactly the same. It just has 3 different percentages that it can offer you. So it can either be a 3-cycle 50% refund program, a 3-cycle 70% refund program, or a 3-cycle 100% refund program. All of those will cover you for up to 3 egg collections. So you'll get 3 cycles separately. They cover you for unlimited frozen embryo transfers as well. They offer you fixed fees, which help you know exactly how much you're spending on your fertility treatment. And this program is available to all patients under the age of 40 who will be using their own eggs. So patients up to the age of 39 will be able to apply into this program. Now, if you're wondering how it works and how you know exactly what refund percentage you will be given, the answer is very simple. We've got something called a medical review, which is necessary for every refund program that we offer. The medical review is the process where we contact your clinic, so SIMS in this case, and we would get all of your medical notes sent over from them to us so that our medical team can have a look at those and assess your eligibility to the refund programs. So you don't need to worry about what percentage you will be getting. You will know that from the beginning. So as soon as we have the outcome of the medical review, our medical team will be able to tell us which programs would be available to you, and then you will be making the payment for that specific refund option. One more thing that is very important to remember is that there are certain exclusions that come with the program. So, for example, the main exclusions would be your initial consultation with the clinic, your initial fertility tests, and your medication. So these will be paid to the clinic directly. And when it comes to the medical review, we don't have any set criteria. So we wouldn't be able to, unfortunately, provisionally give somebody an eligibility outcome. We would have to get all of the medical notes first, and then we make our decision based on a combination of factors. But we'll go through the medical review a little bit more down the line. Now, the next program we will have a look through is our unlimited program. And that one offers a fixed refund amount of 100%. And the difference is that it is more time-based rather than cycle-based. So the unlimited program will cover you for unlimited fresh and frozen cycles over the course of 2 years. If you don't have a live birth within those 2 years, then you would get 100% of your money back. It will, similarly to the refund program, cover you for unlimited frozen embryo transfers, and it helps you, of course, allows you to fix your treatment fees so you know exactly how much you're paying. The unlimited program has a difference in age category, so it is available to all patients who are under the age of 38 who are using their own eggs, so patients up to the age of 37. Again, if you're wondering whether you have to complete your treatment within those 2 years and be in a specific age category, you don't need to worry about that. Once payment is made, that's the only time where we would consider a patient's age. So if you do turn, let's say, 38 or 39 whilst you're on the unlimited program, that's absolutely fine. That's not taken into consideration. And again, the main exclusions of this program as well would be your medical tests, your initial consultation with the clinic, and your medication. So these will always be based on the clinic's in-house price list. And then we've got our last program, which is the multi-cycle, and that slightly differs. So the multi-cycle program is a 2-cycle program, which doesn't offer a refund element to it. So it's more of a cost-saving program, so to speak. So it can help you save up to 30% in treatment costs. So it offers you up to 2 egg collections, so 2 separate cycles. It also covers you for unlimited frozen embryo transfers. Again, allows you to fix your treatment fees, and it is available to all patients under the age of 45 who are using their own eggs. Now, there are similarities in terms of what it does and doesn't include. However, because the multi-cycle program does not have the refund element to it, it is A, on the slightly lower cost side, and B, everybody can be accepted onto it because there is no medical review. So anyone under the age of 45 will be eligible to be accepted onto it. So just to summarize the key benefits of Access Fertility, we allow patients to fix the treatment fees so you know exactly how much you're paying for your treatment. And hopefully that will also result in cost savings for you, as we do have certain inclusions that pay-as-you-go IVF doesn't offer. We can offer patients up to 100% of their money back if they don't have a live birth under the program. And of course, peace of mind. I know that traditional IVF is something that people still might choose, and Access Fertility is always an option, but it's always good to know that you can go either or, that you don't just have one option. And now on the next slide, we see the patient journey. So let me just fast forward that for everybody so you can see. So this is the patient referral pathway. Patients can either find Access Fertility organically through various means of social media or Google, or you can visit your clinic and they will provide you with the information and with a leaflet. Either way, if you're interested in joining us, you can either give us a call, or you can send us an email, and then one of our dedicated patient advisors will register you onto our system. Now, how does that work, and how do you apply to Access Fertility? We will take your details, and if there is a partner going through the treatment with you, we'll take their details as well. But everything with us in general is very quick and very simple. The reason being is that you don't have to come in and see us. Everything happens with us electronically or over the phone. So it's very quick and easy to arrange. Once we've got your details and we've got you registered onto our system, then you will receive an email to join our patient portal. On your patient portal, you will be able to see all of your details, your security questions, all the information, the program that you have applied for, the cost of that program, and you will also have certain forms to sign. So the first form that you would need to sign would be the consent form, and that is signed electronically. Once the partner and, if applicable, the patient both sign the consent forms, and if it is for a refund program that has the refund at the end, then we will send off the medical review. Now, the medical review details will come from the clinic, and generally the medical review takes around 2 weeks to be completed. Once we've got those details, we will then give patients a call, let them know what they're eligible for, and then they can make the decision of whether they want to proceed or not. If you do decide to proceed with a program of your choice, again, we'll just send over a form to your patient portal, which is called the agreement form, and that's the contract. And once you sign that electronically, you can make your payment and then begin your treatment at the clinic. Now, how is payment made? So payment with us is made in full via bank transfer, and it is made before you begin your treatment. So before you have the baseline scan at the clinic, it does have to be made in full, but there are 2 ways that you can make your payment. You can either choose to do a bank transfer, or on our patient portal, you will also find the online banking system that we use, which is generally very quick, and all of our payments do come through within 2 days at maximum. So again, it's very quick to arrange. And then once we've got the payment, we will let you know, we will let your clinic know, and then you can give them a call to arrange the start of your treatment. On that note, if you are worried about whether the process with Access Fertility will delay your treatment or your start date with the clinic, there's no need to worry about that. As I said, we do everything very, very quickly. The only thing that has a waiting time is our medical review. And even then, if it is in very specific and urgent cases, we do try to do the best we can to complete these very quickly, just so we can enroll you into the program. Once you're enrolled, the start of your treatment will depend on the availability of the clinic, just as if you were to go to the clinic as normal. You would have your treatment and hopefully you would have a baby, but if not, of course, Access Fertility will be there to support you, and we would provide you with the refund at the end. And here we've got some of the frequently asked questions. So can patients have additional services that are not covered by us? So I've included this question just to let you know what we include in general and what is excluded and what you can pay additionally if you want to add that to your treatment. So with all of the programs that I've just mentioned, they will all cover you for the egg collections. They will cover you for standard blood works and scans while you're in treatment with us. They will cover you for unlimited frozen embryo transfers. They also cover the freezing and storage of your embryos for up to 12 months for each cycle. And then anything that's covered as a standard part of the cycle with SIMS will be covered with us as well. Now, what does unlimited frozen embryo mean? So unlimited frozen embryos means that if on your first round with us, you created 4 healthy embryos and they were all good enough for transfer, you would have your first transfer usually with 1 or maybe 2 fresh embryos, and any surplus embryos you have will be frozen and stored and can be used at a later date. So if unfortunately your fresh transfers are unsuccessful, then you move on to all of the frozen embryos that you have in storage. And if those don't result in a live birth, then you would start your second cycle, which starts with a second egg collection. So as you can see, with traditional pay-as-you-go IVF, usually frozen embryo transfers are an extra cost, but with Access Fertility, we include that all within one cycle and you don't have to pay anything extra for it. So now onto the services that are not covered by Access Fertility. So unfortunately, because everybody is very, very different, we wouldn't be able to include everything. And as much as we want to cater to everybody's needs, there are some services that will be very, very specific. These services can be anything from a partner's surgical sperm retrieval, to the use of donor sperm, to the use of pre-implantation genetic testing. So these services are not covered with us, but they are fully compatible. So what patients can do is they can contact their clinic if they wish to proceed with something like that, and then they will get the cost from the clinic and will have to pay them directly to have that alongside their treatment with Access Fertility. I've mentioned that already, but yes, the other programs compatible with PGTA, which is the pre-implantation genetic testing. Yes, they are compatible. It's just, as mentioned, you would have to pay that directly to your clinic. And one more thing to say just on the medical aspect of your treatment, Access Fertility will not make any of the medical decisions. So we ourselves are not medically trained because we're not a clinic, but we are a fertility company that partners up with clinics and offers the IVF programs that we just went through. So any medical decisions will always come from your clinic. And I believe we've covered that as well, but just as a quick reminder, payment with us has to be made in full before you begin your treatment. It can either be made through our online banking system, or you can just make a bank transfer. As mentioned, generally we do receive payments very, very quickly, and we always let patients know. And yeah, that is it for me. I hope everybody found that useful, and it wasn't too much information in one go, but please, if you have any questions, ask away. I'll be more than happy to answer those for you.
That was great. Thanks, Olympia. It was very clear.
Good to know.
I'll just have a look at the question box now. Yeah, so one of the questions that we got in is, can I use frozen embryos from previous treatment on your program?
No, so unfortunately, with our programs and the way that they are structured, patients will have to begin from the beginning of their fertility journey. So you would have to start with an egg collection, and then patients can only transfer embryos that have been created whilst they were on the program with us.
Okay, perfect. And another question is there any BMI requirements for the Access Fertility programs?
No, not at all. We don't have BMI requirements. If this is something that you were wondering in terms of the medical review, we don't take BMI into account. If the clinic are happy to offer you treatment, we will be also happy to have you on the program.
Great. So another question we have here is, what do you classify as a cycle? Would you be able to explain that?
Yeah, of course. So when we say that we offer 3 first cycles, what it means is that you have 3 separate egg collections. And let's say you begin your first cycle with your egg collection, and as mentioned, you create 4 embryos. Now, the end of your cycle will only come to an end once you have used up all of the embryos from that round. So round 1, if you have 4 embryos and you choose to put back 1 as a fresh embryo transfer, your first round will not be completed until you have used all of the embryos from that. So you would have a frozen embryo transfer on the remaining 3, and then if unfortunately that round is unsuccessful, then you would start round 2, which would be with another egg collection. Having said that, if unfortunately the embryos are not good enough for transfer, it doesn't mean that you would have to use them all before you move on to your next round. But of course, if the embryos are viable, all of them would have to be transferred before you move on to the next egg collection.
Great, thanks. And another question that we have in is, are the programs only applicable to IVF, or is ICSI also covered under Access Fertility?
Of course. Yeah, we've got programs for IVF and for ICSI. There is no difference between them. It's just a difference in price. So you can either choose to go on the, let's say, unlimited IVF program or the unlimited ICSI program. And I believe after this, we will also be able to share to whoever's interested, of course, a PDF version of the price list, just so everyone can have that information if they want it.
Yeah, that would be great if you could share that afterwards.
Yeah.
I just have another look through the questions. So there is a good question. So what happens if someone is on the program and they fall naturally pregnant?
Yeah, that is actually a very good question. So no need to worry. If you do fall naturally pregnant, first of all, give us a call so we can be happy with you with the good news. But you have 2 options here. And usually people will wait and stay on the program a little bit after they have the 6-7 week pregnancy scan to give us a call and let us know. But you can either withdraw from the program, which means that we will then calculate what we have paid for your treatment so far, and you will be entitled to a partial refund. The thing to remember with withdrawals is also there is €150 admin fee to that, but you will receive a partial refund if you don't want to stay on the program. However, if you also want to have go through the pregnancy and have the baby and then return to the program, that's absolutely fine as well.
Great. Well, that's really interesting. So another question we have in is, do you have to pay the full amount for a chosen plan? So if you do 3 egg collections, if someone is able to get pregnant in the first cycle? So I presume if they're packaged.
Yes. So that is the slight risk element when going ahead with the program. Because you make your payment in full before you begin your treatment, if you do have a live birth, which is the only thing that we count as a success, if you do have a live birth at any point, that is the end of the program with us, and you would have paid slightly more rather than going in to have 1 round of treatment. However, it does have to be a live birth. So in any other unfortunate case, patients can stay on the program as normal and finish their treatment.
Okay. And is there any reason why someone wouldn't get the refund if they completed the program?
No, absolutely not. So we have refunded over 13 million. I would say pounds because that's what we have on our website, but I don't know how much that would be in euros. But that's just to show you that we actually do what we say and what we promise we'll do. So if a patient does finish the program, does go through all cycles on their program, and has all their frozen embryo transfers, there's no reason why you wouldn't get the full amount that you're owed at the end.
Super.
So there is no risk when proceeding with us that we wouldn't give you a refund.
Yeah. I'll just have another look through the questions. Could you explain the age categories again that you mentioned at the start of the programs?
Yeah, of course. So we've got, if we take and break down the programs one by one, the unlimited program is available to all patients under the age of 38 who are using their own eggs, meaning that anyone under the age of 37 would be able to apply and go through the medical review with us. Now, if we take the 3-cycle refund programs, which are the 50, 70, and 100% programs, all patients under the age of 40 will be able to apply to that. However, with the refund program, and I didn't want to add this on in case it was quite confusing to grasp initially, but the 3-cycle 170% programs are offered to patients under the age of 38 as well. So all patients under the age of 38 can apply for all of our programs. Then if we take, for example, the age category of 38 to 40, patients can apply for the 3-cycle 50% refund program and for the 2-cycle multi-cycle program. And then if we take the age category of 40 to 44, then patients can apply for the 2-cycle multi-cycle program, which is available without the refund element to it.
Perfect, thanks. Yeah, no, I think it's good to get an idea of kind of how the age categories work, because it is a question we do get in. So no, that's super. Thanks for going through that, Olympia. We have another question here. So with the multi-cycle program, is it possible to do the 2 egg collections back to back, or do you need to use all the embryos from the first cycle before you can proceed?
Yes, that's correct. So that goes without saying with all of our programs. So embryo batching or back-to-back egg collections, unfortunately, are not possible just because of the way that the program is structured. So in any of those programs, patients would have to finish one round and have all their embryos transferred before they move on to the next cycle.
Okay. Is there any criteria that would make you not eligible for the program?
No, there's nothing very specific that would make you automatically ineligible. As I said, we don't have any specific criteria because we do understand that everybody's case is very different and everybody's needs and everybody's journey so far has been very, very different. So we try to take into consideration a lot of things rather than just one factor that would make someone ineligible. And just to get into a bit of detail in regards to the medical review, we do look at a combination of your AMH levels. If applicable, we look at a semen analysis. We look at general health, general medical notes, and then we also look at previous treatment, if you've had any, or anything that would have to do with your fertility journey. So, for example, if there was a live birth previously, and so on and so forth. So there's not one thing that would ever exclude anyone from the program. It's just that we need to have a look at everything combined and then we make our decision.
Okay. Well, that's good to know. And another good question as well is, what if my cycle is cancelled prior to the egg collection?
So with Access Fertility, we count as a cancelled cycle any cycle that is abandoned before you move on to have your egg collection. However, under the program, we will cover your first fresh cancelled cycle for you. So all you need to do is just give us a call, let us know that your cycle was cancelled. Then your clinic will input that information into our system and you will just be able to restart that exact same cycle with your clinic at a later date. But you don't need to worry about that payment because we will cover that for you. For any subsequent cancelled cycles, you would have to pay a cancellation fee to reinstate those, but it doesn't mean that you have to start the treatment from the beginning or that you would have to withdraw from the program. You can still continue as normal. It's just that you would have to make that cancelled cycle fee payment to reinstate your original cycle. And usually with the cancellation fee, it does differ, but it's very similar. So it can be anywhere from 400 to 500 euro. I believe, Katie, with yourselves, correct me if I'm wrong, is it 500 euro? I think it's
Um,
about 500.
I think
I
it's
would have
about,
to double check that.
yeah, I think it's around that cost, but we can confirm
Yeah,
it if anyone
yeah,
wants
exactly.
to
Can
know, just to
confirm that.
email. Another question is like, can you pay for Access Fertility in installments? But I believe it has to be upfront, 3-year payment portal at the
Yes.
start.
Yes, unfortunately, we don't have any payment plans at the moment. However, of course, patients can seek out a third party to pay us, but with us specifically, we would have to receive the full amount before you can begin your treatment.
Okay. Um,
Having said that, actually, if someone does want to break their payment in, let's say, 2 installments, because they are starting treatment, for example, in, let's say, October 2023, and they can get an X amount to us now and an X amount to us later, that's fine. It doesn't mean that you have to pay all of it in one go and then start treatment, provided that you're happy to fully enroll and start your treatment when you make your second or third installment, that's fine.
okay, no, that's good. That's great. Another question, just if you could reiterate as well, is so if someone is successful on their first cycle, will they get any money back? But I think you had said that they kind of earn the 3-cycle block.
Yeah, yes, it has to be. If someone has a live birth, then that counts as the program being complete, and then the patient will not be entitled to a refund or any remaining cycles.
Yeah. Okay. Yeah, no, I think that's good, just to be clear on that aspect as well. So I'll just have another quick look.
Oh, sorry, go ahead.
No, just having another quick look through the questions there. If you have anything else to add, Olympia.
Yes, I was just going to say, frequently what people pair up with asking about their live birth and continuing the program or the program coming to an end is what happens to any embryos that I potentially had in storage with you. So if you do have any embryos, and you finish the program successfully, we would still cover those until the 12-month period of free embryo storage with us is up. However, afterwards, you would have to just contact Sims and they will be able to give you the annual or 3-year fee, storage fee that they have, but you don't have to worry about any of your embryos getting destroyed or you not being able to use them. These will still belong to you, and you would just have to pay the clinic directly to use them in the future.
Yeah. I'll just have another quick look through the questions. There's just as well, just to recap, someone has asked about the medical review. How long is kind of how long does that take? I think you mentioned it was 2 weeks. Is that still the case?
Yes. Well, we say 2 weeks, to be honest, because we want to allow people to, from your side as well, to have a look through the notes, send everything, see if we're missing anything. But we allow up to 2 weeks. So if your notes are already with the clinic and the clinic are very quick, Sims are very quick in sending those. Generally, our medical team, once they have the data that we need, they take around 2 to 3 days to make a decision. So if we get the notes very quickly, we'll also have the decision for you quicker than that. But generally, we allow 2 weeks.
Okay, great. Yeah. I'll just see if anyone else has any more questions. Feel free to pop them into the Q&A there. I'm just having another look to make sure we've covered a lot of them.
Yeah, absolutely. And then I know I'm conscious I'm still sharing my screen, but yes, if everyone
No,
can
it's
see
okay.
this.
So someone has asked, if you're very unfortunate and you do miscarry, you are refunded in those circumstances.
So if unfortunately someone does miscarry, then they have two choices. They can either continue on the program whenever they feel ready, and then in that case, they will get their refund at the end. Or I understand that in some cases, fertility treatment, you might not want to continue, or you might just generally want to take a little bit of a break for yourself. So if that is the right option for you, just call us and we would arrange the withdrawal for you. Having said that, the withdrawal is not getting the refund at the end. The withdrawal is getting a partial refund whilst you haven't completed the program. But if a patient didn't want to continue, or they were on their last cycle and unfortunately they've miscarried, then yes, they would receive their money back.
Okay, great. No, thanks for clarifying on that, Olympia.
No, of course, we would never want to force any patients to go through treatment when they don't want to. Then I understand, because sometimes, you think you've paid for 3 cycles and you're thinking, oh, but that's a lot of money and I've already got it. I've already paid for it, but we don't want to force patients to go through treatment if they don't want to. So of course, there is an option to opt out if you don't feel ready or you don't want to continue.
Yeah, no, that's great. And I think there might just be one more. Can Access Fertility be used in conjunction with any insurance providers? Do you know?
Yeah, for our Irish patients as well, we've had a lot of people who have been interested in have done that in the past, where they would ask us, the details of the program, and then we send them, and their insurance does cover that. So if you're interested in something like that, definitely let us know. We don't make itemized receipts, unfortunately, because the payment is made for your treatment in bulk, so we cannot specifically list everything. But we send something out called a letter of confirmation, where all of the program, the price, the date you paid, everything is listed, and we found that works quite well with most insurances in Ireland.
Yeah, no, that's brilliant. That's great. And yeah, so just another question. So can the plan be put on hold if there's a reason that you don't want to continue treatment straight away again if you don't have a successful cycle?
Yes, of course, of course. So what we advise to patients is, because there is a medical review involved, for the refund program, the 3 cycle ones, you can take a break of up to 6 months without having any treatment at all. If you do need longer than that, just because we might have to re-review your medical notes, just give us a call. And in most cases, we would, of course, let you continue whenever you want to, but we would say we might have to re-review your medical notes in that case. Now, for the multi-cycle program, there's no time frame at all. So if you want to take a break, then you can, whenever you're ready. You just need to give your clinic a call, and they will then arrange the start of your treatment again for you. However, if we are looking at the 2-year unlimited program, what I would say is, because the program begins as soon as you make your payment, it is good for patients to try and do their treatment very well, just so you can make the most out of those 2 years, because that 2-year program can offer you a maximum of 5, maybe 6 fresh cycles at a push. But it also depends on how many embryos are created each round, because you'll have to transfer the frozen ones as well. So if you're looking, if you know that you might be one of those people that needs to take a little bit of time because it takes a toll mentally or physically for you, then I would recommend something that's more cycle-based than time-based, just because you might not be able to fully benefit from the 2 years if you want to take a 3-4 month break for yourself.
I know that's great. Just to clarify on that, that's brilliant. Thanks,
Yeah, exactly.
We'll just have another quick look at the questions and see, is there any more? I can leave it open for another few minutes if anyone else has any questions that they'd like Olympia to talk through.
Yeah, of course. I know that it's a lot of information to probably process for everybody. But yes, if you would like to even speak to one of our patient advisors, we are open Monday to Friday from 8 a.m. to 6 p.m. Generally, we are a very responsive team, so someone will be with you on the phone within the first 5 minutes of your call. And then for emails, we do respond to everyone on the same day. So if even something comes to mind after this that you would like to discuss with us, you can always give us a call tomorrow and we'll be more than happy to help you, really.
That's great. Yeah, no, that's brilliant, Olympia, that you can contact yourselves directly if people have any more queries or questions, or, it's, as you said, it's a lot of information to take in in the one sitting. Yeah, definitely. I'll just have another quick look and see. I think we have answered most of them, which is great. I think that's all of them.
I believe I saw one more now, about the unlimited program. Does that come through now?
Yeah, I see that one there. They're just wondering, how much money is it upfront for the 2-year cycle? If you have
So
them.
as mentioned, we can send out the pricing to patients afterwards, but I can have a very quick look right now and just let you know. But the reason why we don't share pricing on our website is just because it does differ from every age category to another, and it also differs from clinic to clinic. So we can only have the starting price. But just to give everybody an example of the cost, the unlimited, which is the one that offers the most cycles and the 100% refund, would be €16,950.
Yeah, I think as well, it's so
Yeah.
dependent as well on, as you said, the different programs and the ages, and whether it's cycle based or time based. It is I think quite individual. So I think the price list we can email out afterwards. And yeah, I think the Access price list for Sims as well is on our website, so people can find that there as well.
Does vary a lot, because just to give another example, the unlimited is the €9,050, but then if we look at the multi-cycle, it's 9,300. So they vary a lot from one program to another. And while we're at it, I've had a look at the cancelled cycle fee with yourselves as well. So it is €500. Yeah.
That's great, Libya. I think that's all the questions. If you have anything else to add, I can give it another minute or two, just in case there's any other ones.
I think there's one more that came through. Yes, if it's the one that I'm seeing now, if you can have unlimited cycles for 2 years, yes, you can have as many cycles as you can fit within those 2 years. And not just the first cycles, but also all of your frozen ones will be included as well. So technically, if you start with us and you have 6 embryos created from the first round, that counts as 1 round, but you will have 6 embryo transfers within that. And then you can move on. And then again, if your second round is unsuccessful, you can move on, and so on and so forth.
Yeah. I think we've covered all of them now. If you have anything else to add, Olympia, to the programs?
To the program specifically, no. I think we've given people enough information for one day. But definitely, if anybody is interested in getting a price for the programs and some additional information about the ins and outs of it from our patient advisors, you can always get in touch with us. Our email is support@accessfertility.co.uk. And then I believe, let me just find we've got a contact form that patients can fill out if you would like to leave us a call back. And let me just share the number as well. So yes, if anyone requires our number to give us a call, it would be 01485 4405. That's 01485 4405. And we're open from 8 a.m. to 6 p.m. and more than happy to help you.
Yeah, no, that's great. So yeah, if anyone has any further questions, as Olympia said, you can feel free to contact Access directly if they're more specific, and a member of her team can go through it with you again as well. So I don't think there's any more questions in there. So thank you very much, Olympia. It was great to go through. There is a lot of information, and I think it's great to have someone from Access explaining it, going through all the programs. It was really helpful. It was great. So
Thank you. Thank you for having me, and thank you for everybody and for the questions submitted. And as mentioned, anything else you need, just give us a call.
Yeah, no, that's super. So I think we can leave it there. There's no other questions outstanding. So thank you everyone for joining, and hopefully everyone found it informative. We do have all the Access Fertility information on the SIMS website as well. So feel free if you need more information or you want to recap on any of what Olympia has gone through tonight. It is on our website as well. So thank you everyone. And thanks, Olympia.
No worries. Thank you. Thank you all.
Thank you.
Take care.
Bye.
Bye.